If your loved one spends a lot of time in bed, a wheelchair, or the same chair, it's very important that you know about pressure sores, sometimes called bed sores. They're very preventable, but they can also get serious quickly if they're missed. What is a pressure sore? A pressure sore happens when skin breaks down from a person staying in one position too long without shifting weight. They show up most often over bony areas, the tailbone, hips, heels, ankles, and elbows, because that's where there's less natural cushioning. On fair skin, a stage 1 pressure sore just looks like reddened skin that doesn't go away. On darker skin, it may look more like a change in texture or a slightly different color rather than obvious redness. In this case, touch matters as much as a visual check. If it's caught at this stage, it's usually very manageable. If it's missed, it can progress. The skin can break open, form a blister, then a deeper wound. At stage 4, the wound extends into muscle or bone and can lead to a painful bone infection or sepsis. That's why catching it early is so important. One more thing worth knowing. If your loved one has diabetes or nerve damage, they may not always feel pain from a developing wound the way you'd expect. Nerve damage can dull those pain signals. That means a sore on the foot or a pressure point could go unnoticed longer than it should. This makes regular visual and tactile checks even more important, not just relying on your loved one to tell you something hurts. The best treatment is prevention. Here's why this matters so much. A pressure sore can worsen shockingly fast, sometimes from stage 1 to stage 4 within just a day or two, and in serious cases, can become life-threatening. If your loved one spends a lot of time in bed, help them shift position roughly every 2 hours. A simple trick: set a phone alarm for every 2 hours as a reminder. It's easy for repositioning to slip when you're focused on everything else. If they're in a wheelchair, a cushion helps redistribute pressure, and they should shift their weight periodically too. Keeping skin clean and dry, especially after any incontinence, and making sure your loved one is eating and drinking well also helps skin stay resilient. A simple habit: during bathing or dressing, take a moment to glance at these spots. It only takes a few seconds, and catching redness early can prevent a much bigger problem. If the skin does start to break down, some caregivers find ointments like zinc oxide, A&D ointment, or medical-grade Manuka honey, not regular kitchen honey, helpful for protecting the area. But always check with your care navigator or HHA nurse before starting any treatment, since the right approach depends on how serious it looks. If you ever notice a reddened area that isn't going away, or any change in the skin over these bony spots, you should absolutely mention it to your care navigator. The earlier it's caught, the easier it is to treat.